One, I am not the donor. My dear friend Jerry Jones, who is no more now, is the donor. He left an estate of $20 million. And his mandate, he put his daughter and 4 friends as the trustees. And his mandate to us is to liquidate the surplus in 10 years. And believe me, we are finding it difficult to get good recipients to whom we can give the donation. And we are indeed grateful that we could find Basavatarakam. And I found Basavatarakam not as a donor, as a patient. At the age of 80, I was diagnosed with cancer of the prostate. Dr. Sendil and Dr. Dilip and a host of others, they have made me recover. I'm still an international volunteer. I travel globally. And they have given me a new lease of life. So we are ever grateful. And I waited till my treatment was over to propose that we give a donation so that there is no conflict of interest in between my being a trustee and donation making. I have seen the reason we have given the donation is what he read, that I have seen as a patient how the Arogyashri patients and poor patients and those who are affordable, who are affording the thing, and the rich patients, they were given the same treatment. They were in the same treatment. See the clinician, or to undergo radiation, or to MRI. There was a queue, and I was in the queue, and we used to do. Such equitable service is indeed unique and commendable. We are indeed grateful that you accepted our offering. Thank you.
The test called as flow cytometry or immunophenotyping, which is very essential, is available only to those who can spend a good amount of money. And then this shortcoming was observed by an excellent, very good organization called as Rotary Club. Rotary Club of Hyderabad Deccan identified this deficiency, and they have come up and donated to our hospital an equipment which is latest 11 colored flow cytometry to our organization. The Rotary Club Hyderabad Deccan, in partnership with another organization, have donated their own money for our benefit. So to honor the Rotary Club, representing the Rotary Club Hyderabad Deccan is the President, Mr. Shailesh Gummideli. I request you, sir, to kindly come up to the dais and accept a token of appreciation.
This activity. In fact, this all started when we used to visit MNJ hospital to spend Diwali with the little hearts who have been affected with cancer. After a couple of years, we thought, I think we are doing too little. Okay, for a day we are able to get some smile on them, but why can't we participate in a bigger way? Then an idea has stuck, and we met Dr. Senthil. Then we strike a deal like, how do we help these children? Then they said this cytometer would be a helpful equipment where we can support all these children. Then we thought Basoka Tararam is the best place and where our objectives and ideals are same. Why don't we keep this unit at this level so everybody is safe? So that is how we ended up giving this machine and installing this machine in this great hospital. Thank you very much.
All of us have seen and experienced the magnificent movie called Bahubali. And all of us would definitely at some point in time thought of a hero being like that. And in fact, some of us might have also thought that I would become like Bahubali. At least the children.
Met Dr. Sendil and Dr. Kuppu around 5 years back. My father was diagnosed with lung cancer. So from then on, it's been a personal experience. I've personally experienced the great work that the doctors, the staff of this hospital are putting in, and it's been a very humbling experience for me. So my father wanted me to do something for the hospital. He passed away around 1.5 years back. So I took the easy way out. I just decided to donate money. So it's actually the tough work is to actually put in time and effort. Donating money is easy, but I'm happy that I could contribute. Thank you.
Now moving on with the oration, I request Dr. Sendil Rajappa, Head of Medical Oncology, to introduce the oration.
Thank you, Krishna, and good evening, all of you. On behalf of everybody here, I want to thank Professor Pramesh for coming here this evening to deliver this very prestigious oration. Just for people here to know what this oration is all about, let me go through a few points here. Dr. Kuppu Swamy was born on January 2nd, 1901 and had his early education in today's Tamil Nadu. He obtained his MBBS degree in 1926, that's nearly 100 years ago, from the Madras Medical College, Chennai. Dr. Kuppu Swamy started his private practice in Chennai with his senior partners Dr. Rangachari and later Dr. Mohan Rao, leading medical practitioners at that time, before starting his own private clinic. He was personal physician to many leading public figures of the time like Privy Councillor Sir Muhammad Habibullah and Sir C.P. Ramasamy Iyer, the later day Diwan of the primary state of Travancore. In 1941, Dr. Kuppu Swamy moved to Trivandrum to take over as the Darbar physician and the private doctor of the royal family of Travancore. He was also simultaneously the senior medical officer of the Travancore state and officiated as the Surgeon General before meeting untimely death in 1953. This oration was instituted 5 years ago by his son, Professor Ananta Padmanabhan, who spent a lot of his time at IIT Madras as professor and then as dean at the IIT Madras. He actually relocated from Hyderabad back to Chennai very recently. He is now professor of eminence at the College of Engineering, Gindi Anna University. In fact, because he's moved back to Chennai, he is unable to be with us this evening, but he sends his best wishes and greetings especially to everybody here and Dr. Pramesh in particular. So that's all the oration. I want to thank Ramesh again for coming here this evening to deliver the oration.
Request our beloved medical director, Dr. T.S. Rao, to introduce the speaker.
Good afternoon. It's indeed a great privilege and pleasure to introduce this wonderful friend of mine and friend of this hospital. I've always grown up understanding and believing that you cannot make a great friend after you are 25 years. And if there has to be an exception, Ramesh is one, as far as I am concerned. He's somebody who I met about 15 years back and have learned so much from him, walking a few miles along with him. Somebody who looks like a man possessed, man with great concepts and a conviction that matches each concept that he has developed and made others imbibe and follow. I would have been richer, much more enhanced and expanded in my life if I had known him much earlier in my life. And he is 6 years younger than me. He was born on 1st May 1970. He is the professor Division of Thoracic Surgery and the Director of Tata Memorial Hospital. He did his MBBS from Coimbatore Medical College and went on to do lab, FRCS, DNB and PG Diploma in Clinical Trials from prestigious institutions across the world. Professor Ramesh has been a convener of National Cancer Grid from the year 2012 till date and is affiliated to many prestigious organizations and boards across the globe. He is also a member of American Society of Clinical Oncology, International Association for the Study of Lung Cancer, International Society for Diseases of the Esophagus, European Society of Thoracic Surgery, and European Society of Diseases of the Esophagus. He has been a recipient of many prestigious awards and is an active editorial member and reviewer of many oncology-related journals and periodicals. He also has been a principal investigator and a co-investigator for clinical trials. He has actively published many journal articles along with fellow contributors and also has contributed to chapters which have been included in bibliographic resources related to oncology. Professor Ramesh has come a long way in his medical career, starting as a house officer with Coimbatore Medical College way back in 1993 to his present position as the director at the prestigious Tata Memorial Hospital, Mumbai. He has a keen interest in minimally invasive surgery and evaluation of their role in thoracic malignancies, and that's where we actually work very closely together. Ramesh has been here before and he has always been with us. And if we are one of the core members of the National Cancer Grid, his brainchild it has been, and he has worked relentlessly developing this. For those who have been skeptical, the list include me. He has proven us wrong by making this a formidable organization and actually elevated India at the global level. He has put India on the global map. He looks short and diminutive, but a man of steel, man of great power. My dear friend Ramesh, it's a privilege to have got the opportunity to introduce you.
Thanks again, Krishna. Just to tell you that this oration is generally not given to somebody for the work that they have done as a doctor. I think if we have to give it to somebody for the work that they have done as a doctor, then many people sitting in the crowd, and including Dr. Kuppu, qualify for that. There's somebody who's putting up their fingers up in the crowd. So, the reason for giving this award, this citation and this oration is because you go beyond your call of duty to do things that everybody sitting here and most of us wouldn't generally do. And that's the reason why Dr. Ramesh is here today to receive this citation award and do the oration. So let me read the citation that we're going to give in honor of this oration. This citation is in recognition of his outstanding contribution to cancer care in India. Professor C.S. Ramesh has been the convener of the National Cancer Grid since its inception in 2012. He's been the driving force behind the many initiatives of the National Cancer Grid, which range from implementing state-of-art cancer care across India, research, development of high-quality human resources, just to name a few. He's been instrumental in getting together all stakeholders in cancer care, which includes cancer care institutes, research centers, and patients group, to establish uniform standards in cancer care management, promote collaborative research, and provide specialized training. He has been selfless and tirelessly working for almost a decade beyond the call of his regular duties and responsibilities at the Tata Memorial Hospital to ensure that the NCG meets its objectives. Apart from his role in the NCG, Professor Pramesh is actively involved in conducting several courses in research methodology, bioethics, biostatistics, and scientific writing, which are some of his passions. His interests range from basic sciences to clinical management, and it's noteworthy that he is at present involved in one of the largest population-based screening trials for upper aerodigestive cancers. Professor Pramesh is the director of the Tata Memorial Hospital since December 2018. He is a prolific minimal access surgeon with special interest in lung and esophageal surgeries. The countless smiles he has brought to patients and their families stand testimony to his hard work, sincerity, passion, and compassion towards cancer care. We at Basavatarakam Institute salute Dr. Pramesh's indomitable spirit and enthusiasm towards cancer research, education, and patient care. Professor Pramesh, we are really proud to have you here. It's a privilege indeed.
That I've ever had in my life. So, as I mentioned before, it's a privilege to be part of this meeting, to be part of all of you, for several reasons. First, my association with this hospital goes back a few years back when I first visited here to be part of a workshop. And as I see how it has grown over the last few years, I realize that this is an institution which is destined for greatness, not just now, but in the years to come as well. I'm not saying this just because I've been invited here to give this oration, but for a hospital, and having been in a similar hospital for 20 years now, for a hospital, the two most important aspects of what qualifies as success for the hospital are first, what your patients do for you and what your patients feel about you. I think we've already had examples from the donors today about how well the hospital has treated its patients, and to me, the growing numbers of patients that are treated in this hospital are a testimony to that. The second most important aspect for a hospital to be known as a success is how it treats its employees. And the very fact that at this time of the day, there are so many of you packed into this auditorium, the fact that, as I mentioned to Dr. Rao earlier before we came here, that the attrition of employees here is extremely low. And this is not something which is routine in today's world. For those of you who are in the medical profession, we all know that doctors change hospitals every 1 or 2 years. And the fact that most of the doctors here, most of the paramedical staff here, most of the other employees here have stayed here for such a long time is again a testimony to how the hospital treats its employees. And to me, these are the two most important things that a hospital should look at if they were to qualify themselves as a success. It is not global recognition, it is not national recognition, it is not am I the #1 hospital ranked by Forbes magazine or by Week magazine. It is what your patients think about you and what your own employees think about you, and this is why I feel truly humbled and privileged to be part of this. I also feel very humbled by the fact that I'm giving an oration after Dr. Kuppu, and it is truly ironical, and I didn't realize this till a few minutes back, that his son, who's currently at the Anna University, Guindy, and my father, who after he retired from his active service at the Tamil Nadu Agricultural University, also worked at the Anna University, Guindy. I think this is just a twist of fate to which I'm very fortunate to be a part of. So when Dr. Rao asked me to speak today, I was a little taken aback by what I should speak on. I could speak about several other areas related to medicine which I have been part of, sharing my experiences about treating patients with cancer. But I feel that this hospital, along with our own hospital, the Tata Memorial Hospital, shares something very common, which is a very social face to it, which goes beyond just the cutting-edge medicine and healthcare facilities that we are able to provide for. And that is the reason I thought I would speak about the story of the National Cancer Grid. To many of you who have not known this map here that you see is actually the origin and the seed from which the National Cancer Grid was born. So you might wonder what this map represents, but this is a map of 75,000 patients who visited the Tata Memorial Hospital over a 6-month period. What we did was to geotag every patient who came to the hospital and look at where they came from. So this is where we are located in the city of Mumbai. So the density of patients who come from this area is understandable. You would expect that, as in many other hospitals, you would see patients from around that area come to be taken care of there. But what you see is a very disturbing figure here. The large number of patients who come to us from northern, eastern, and northeastern India. And this is truly tragic. I don't need to tell this audience that the time that it takes to travel from Naharlagun in Arunachal Pradesh to Mumbai by train could be anywhere from 2 to 3 days. Take into account the cost and the expenses of staying in a city like Mumbai for a few days and then going back for 2 to 3 days again, traveling through thousands of kilometers. So this is not something that we should be proud of. This is not something that we should say we have patients from across the country coming to my hospital because my hospital is so great. I think we should be ashamed of the fact that the healthcare system in the country forces people to do that. These people don't do this by choice. They don't have a choice, and therefore they are required to travel to cities like Mumbai, Hyderabad and Chennai. So therefore I thought I would talk about something which is very close to my heart, which is how do we eliminate disparities in cancer care in the country? So we need to start off from a slightly far view, which is the entire philosophy of what is fair in this world. What is it that makes us human beings? What is it that separates us from those who cannot think? And to me, one of the fundamental aspects of this is equality. As human beings, we need to strive towards equality with our fellow human beings and ensure that the very basic necessities in life are met regardless of who you are, regardless of where you come from, and regardless of how rich or poor you are. This entire sense of equality also needs to look into the differences between equality and equity. Though these might seem very similar, what you see here is equality. So here you see 3 children of varying heights wanting to watch a game in a stadium, and because they cannot afford it, they are forced to stand on top of these stools trying to peep over this wall trying to watch the game. But look at what is happening. The tallest of the children is able to go across the wall and be able to see the entire game, the spectators and the entire soak in the atmosphere of the stadium. The next taller person is able to just about make it. He doesn't get the entire atmosphere but is still able to barely about make it. But the third child, who's very short, in spite of being given a boost by this little stool here, is unable to see anything. We've been equal because we provided all 3 children with the same height of the stool. What is important to achieve is what we call equity, where those who do not have the ability to do so are held higher. Those who are less capable are held a little more, and those who are able to see things and go through life without any difficulty do not require any help. This might not seem fair. This is not justice. This is not the same level of help being given to three different people. But to me, this is more important than what we see here, because here we've seen everybody get the same access to what the privileged have. And for those of us who lead privileged lives, and all of us who live here live privileged lives, who are in the probably in the top 1% of the country's population as far as our wealth goes, are unable to realize that you need different levels of help to meet different people. To me, even this is not adequate. What you really need is for this wall to come down so that without any help, everybody who's a part of this entire process is able to access what they richly deserve. And to me, that is the basis of what equality is about. Now, take a look at what is happening in the world today, what is happening in the country today, what is happening even within a city, and look at the inequalities that we see. These are not things which we can correct overnight. And to me, if you look at what are the basic human rights, if you ask what makes a human being be a human being and not something else, most of us would think it is food, clothing and shelter. I would add two fundamental aspects to that, which is access to good individual cancers or age-adjusted cancer rates were increasing. They're exactly the same. 2 decades back and today, the cancer rates adjusted for age has not changed at all. But because of the fact that we are a growing population, because of the fact that our life expectancy is higher, because of the fact that we are getting more and more urbanized and the resultant lifestyle changes, the absolute numbers are likely to go up 70% in less than 2 decades. So this is a problem that we need to deal with very quickly. In addition to that, there are huge inequities in access. As you can see here, South India is the most privileged. We have the highest number of radiation equipment, the most number of cancer treating beds, the most number of healthcare professionals. And as you can see in some of the other areas, these numbers are much lower than what otherwise should be ideal. We also have economic inequities in access. So for those of you who are unfamiliar with this area of work, in health economics it's been clearly shown, at least in India, that the majority of expenses is borne out of pocket, which means that when patients require healthcare, the vast majority, close to 3/4 of the expense is met from their own pocket, sending a large number of people into bankruptcy. It is estimated that every year 6 crore Indians go below the poverty line because of healthcare related expenses. There was a recent report done by Ernst & Young which looked at what is the gap that we have with cancer care facilities in the country. With most of these metrics, what we currently have is exactly half. This would be what the bare minimum would be. If you need 900 linear accelerators, we currently have just under 500. This is 2015 data, we currently have just under 500. When we require 12,000 beds, we have 6,000 beds. If we needed 550 cancer centers, we currently have 250 cancer centers. So every aspect of cancer care, there is a gap that needs to be addressed. It's not very easy for people who are not in the profession to realize the challenges that all our hospitals go through. The Tata Memorial Hospital is a sister institution of the MD Anderson Cancer Center, which is the largest cancer center in the US. We are remarkably similar. We see almost the same number of patients annually. They see 42,000 new patients annually. We see 46,000 new patients annually. They have 1,700 physicians on their staff. We have 188. So this is the kind of reality that we need to deal with on a day-to-day basis. And I'm sure also the hospital is very similar in the number of staff that they have to the kind of staff that they really need. These are challenges, these are real challenges, and how we address them is what we need to look at. Again, we come back to this. The solutions could be to build new hospitals. The solutions could be to come up with a new comprehensive cancer plan. The solution could be to build new medical colleges so more doctors come in, to have more oncology training centers come up so that you have more people to treat cancer. But that will take decades to mature. We don't have the time to wait for decades because every single patient who needs treatment and is denied the treatment because of lack of access suffers as a consequence of that. So we had to take a lot of active initiatives. Many of them have succeeded, some of them have failed. We have failed. I will be the first person to admit that many of the National Cancer Grid initiatives have not seen the light of the day. One of our first thoughts that we wanted to do has still not materialized. But the fact remains that we are not afraid to try something new. We will try, we will fail in a few, but we will succeed in a few. And I'm here to share some of our successes and some of our failures. So some of the first things that we did was to first identify what the problems were. And this was a series of papers that we wrote for the Lancet Oncology, where we looked at what is the current burden of cancer in India, what is the exact burden, how can we do research which is specific to India and relevant to India's context, cost-effective research to make sure that we are able to improve access to care. And finally, what are the processes that we need to go through to make sure that we are able to increase affordability and accessibility to cancer care. One of the first areas that we took on head-on was to have consensus guidelines. There have been several such efforts in the past to create guidelines for cancer care in India. Unfortunately, most of them have been very impractical. So, for example, one cancer guideline would run into 70-odd pages, which makes it almost certain that nobody would read it. So we wanted to make sure that we created guidelines which were practical to India, which were based on data relevant to India, and therefore would be applicable to patients being treated in these hospitals. So we started this exercise 3 years back. But we also realized that if you came up with guidelines, it did not mean that they would always be followed. And this is not followed not for reasons that doctors don't want to follow guidelines, but for various other areas. For example, affordability of patients. So what we thought should be a natural next step would be to see whether there could be some way we could tweak the guidelines to make sure that these guidelines would be applicable even to the poor patients in India. There are two major cancer organizations in the world, the American Society of Clinical Oncology and the European Society of Medical Oncology. And both of these organizations came up with some frameworks which got value into the picture. So when you start a new treatment or when you suggest a new treatment, is it value for money? Is it cost effective? And they have two main scores. Not surprisingly, there was virtually no agreement between the scores developed by ASCO and the ones developed by ESMO, which makes it clear that if they cannot agree even in a high-income country, it was very unlikely that these same value frameworks would be applicable to a country like India. And what was more shocking was the fact that as the cost of a treatment increased, the outcomes actually became worse. You would expect that if you spend more on a particular treatment, the outcomes would be better. There was an exact inverse correlation. What actually we showed was that when the cost of a treatment escalated, the outcomes actually became worse. So clearly the market could not be trusted to decide whether a treatment was good or bad. Compounded with the same fact that 1/4 of our expenses, of our healthcare expenses come from public government expenditure, and nearly 3/4 of expenditure is out of pocket, which sends people into bankruptcy. Just to give you another idea, I know the MD Anderson example resonated with you. Let us think of what our public expenditure on healthcare is. I compared two countries which are both Commonwealth countries, very variable in the levels of income that they have, but nevertheless both have a public healthcare system to rely upon. The percentage GDP spent in Canada is 11%. The percentage GDP spent in India from public expenditure is 1.5%. This would not even be as bad if the per capita GDP was similar. The per capita GDP in Canada is over $45,000 US, whereas in India it is under $2,000 US. So effectively, what the government spends on one individual for healthcare, all of healthcare, is over $5,000 US in Canada and under $30 US in India. So clearly, the inequities that we face here are very, very significant. So we did the next best thing, which was to try and see how we could avoid wastage. And we came up with this new set of recommendations, which we called Choosing Wisely for India in Cancer Care. So for those of you who are not familiar with this is an initiative which started from the American Board of Internal Medicine, and they wanted to identify common practices in healthcare which were either wasteful or even harmful, but were performed commonly by physicians. So we came up with our own list of Choosing Wisely India for Cancer, which has now been accepted globally. As a second edition, a revision of what the initial guidelines were, 250 of India's top oncologists came back to Mumbai a couple of months back in the month of September to identify what were the guidelines that should be funded by government expenditure. Clearly, if you looked at the state-of-the-art guidelines, the very low 1.5% GDP spent by the government would not be adequate. So therefore we came up with what we call resource stratified guidelines, which makes only the cost-effective treatments being recommended as part of the National Cancer Grid. And I'm happy to say that Ayushman Bharat and several other state insurance schemes have adopted the resource stratified guidelines as a measure by which they will reimburse patients for their healthcare expenses. We know that in India, having guidelines is one thing and having them implemented in institutions is something very different. So we wanted to make sure that there is a quality assurance program within the National Cancer Grid members. So what we do is to have a peer review of organizations or healthcare institutions which volunteer to get themselves open to an audit.
From the day one of this organization, they were like the pillars of this organization, like where the governments of both Andhra and Telangana governments, and also like our private and organizations, like and also the banks, and also the patients have been coming here, and the compassion shown by our doctor, the staff, and everyone, by which the day they step into the hospital with the cancer has to do with also more of trauma, and which they get out of it, and half their, because most of the patients they die because of the trauma and the scare. That one thing is that the awareness they don't have about the cancer which we do, which we have we do regular CME camps where our doctors they go to the each and to the Duke and other corners of the state and states, and they bring about an awareness about cancer and do some spot screening and needed, whatever is needed, medical attention is given to them, and if necessary they are brought to the hospital and various tests. And it's the only cancer hospital in the country which in the mobile clinic we have a mammography and ultrasound and X-ray, and so like that, and one which is not affordable by the poor, so which that is the intention, our mission, and is to provide this treatment to the poor with international standards at an affordable price. And the second thing is we also have a research and development R&D unit, which we constantly are trying to know of course some of the reasons are like, but other than that, what are the other reasons like of eating habits or other habits like drinking or smoking and like that. And today, unfortunately, still the incidence of cancer is I think is the second in the country, and we are trying our best through R&D also to find out the other reasons for this disease. So I would like to today my heartfelt gratitude to all who have joined us on this great journey, inspiring us every day to do more and great, like Dr. Parmeshkar, who is here now today on this oration day to give us his speech. I would say not speech, or I would say his more than a speech. Many of you are here because he was associated with our hospital also. I think 5-6 years back, Dr. Parmeshkar was here, and more than I said, like the speech, the inspiration, which is going to give us all. And I'm very thankful once again to all the contributors and the philanthropists and Dr. Parmeshkar. Thank you one and all.